Hello, and welcome to our presentation on filling in the information gap on the implications of new mentorship models in acute care, registered practical nurses, and mentorship of undergraduate nursing students. My name is Dr. Kateryna, and I'm an assistant professor at the Daphne Cockwell School of Nursing at Toronto Metropolitan University. And today I'm presenting on behalf of my team, Tommy, Dr. Areej AL-HAMAD, Dr. Yasin, Mathumesa, Guilherme, and Anastasia. On this slide, you can see the table of contents of our presentation and what you can expect to hear. In terms of our study objectives, we really wanted to explore the lived experiences of registered practical nurses and undergraduate nursing students during acute care clinical placements with a focus on mentorship and professional development. Particularly, we wanted to answer the following questions. How do undergraduate nursing students experience registered practical nurse mentorship in terms of its influence on their clinical confidence, competence, and decision-making in acute care settings? What are the perceived challenges and benefits experienced by registered practical nurses when supporting undergraduate nursing students during acute care clinical placements? And finally, what strategies do registered practical nurses employ to support undergraduate nursing students in a way that enhances student learning while also fostering the registered practical nurse's own professional growth? In terms of the context, healthcare restructuring and staffing shortages are reshaping clinical education. Acute care settings are increasingly relying on registered practical nurses to mentor undergraduate nursing students. The key issue is this shift challenges traditional assumptions about who mentors students and how professional roles are defined. The reason why this matters is because mentorship dynamics are changing and they are influencing both nursing education and clinical practice expectations. So we need more research to understand the lived experiences of registered practical nurses and undergraduate nursing students. These insights will support the development of clinical education models that align with real-world practice environments. In terms of our methodology, we are conducting a qualitative phenomenology with interpretivist epistemology. What we will do is conduct semi-structured interviews to explore relational and contextual factors shaping mentorship of this nature. We will then conduct thematic interpretation to identify the essence of lived experiences of the individuals involved in such a mentorship model. In terms of ethical considerations, typical ethical considerations as applicable to the conduct of qualitative research will be maintained in our study. And finally, in terms of the rationale, this reflects a paradigm shift in healthcare research towards recognizing multiple truths and subjective experiences. And this is why we have selected this particular methodology to study the mentorship relationships between registered practical nurses and undergraduate nursing students. As the study is actively currently undergoing data collection and analysis, we will only share preliminary findings. From the registered practical nurse perspective, mentorship is rewarding and supports professional identity. The significant challenges that such a mentorship model include unclear mentorship role expectations and resource limitations and systemic barriers. In terms of preliminary findings for students, from a student perspective, these include report greater clinical confidence and improved practical skills. Some tensions, though, are noted around scope of practice boundaries between the two groups. So in conclusion, our study highlights the need to revisit ontological and epistemological assumptions in nursing education research. Our study examines registered practical nurse mentorship of undergraduate nursing students in acute care to promote inclusive and collaborative educational models, especially with the current resource constraints when it comes to healthcare human resources. Offers insights to guide curriculum design and workplace planning amid evolving healthcare structures as well. On this slide, you can locate our references in case you wanted to access any of these resources for further knowledge attainment. And finally, thank you so much for listening. On the slide, I include my contact information in case you are interested to learn more about our study.